On days Dr. David Urbach is in the OR, he scrubs into surgery up to 7 times. But he knows all that hard work is doing little to help Ontario's massive surgical pileup.
We've never seen a backlog like this. Ultimately, this is a big public policy risk. Like, how do we ensure that there's confidence in Canadian Medicare and the Canadian health system?
Canada's biggest province estimates the waitlist has grown to between 225 and 250,000 patients over the course of the pandemic. Jana Jones was told she would have to wait up to 3 years just to see a specialist in Toronto. In constant pain caused by endometriosis, the Fredericton resident opted to pay almost $40,000 to have her operation in the U.S. instead.
By the time I waited that 2 to 3 years, it's hard to say what other organs it would have been damaging.
Her province, New Brunswick, is also facing an accumulation of 22,000 patients, up 10% since the pandemic. Only British Columbia has fewer people waiting for surgeries compared to March 2020, down 6%. And about 88,000 people there are at a standstill with their treatments. In 2019, Alberta did implement an initiative to tackle its wait lists with hopes of increasing publicly funded surgeries, contracting to private clinics, and upgrading operating rooms. But COVID put that program on hold. The province has now hired an independent official to oversee the plan, as more than 70,000 Albertans sit on the wait list.
Today's announcement will help repair the damage caused to our healthcare system by the pandemic.
The federal government recently offered up $2 billion to help with the backlogs, but not a single province or territory could tell us how they'll use the money. And most say it's not enough.
When you don't have a clear plan about where you're going and what your goals are, and data and accountability within the system to see if you're driving towards and meeting those goals, you're going to end up with chaos.
Provinces are mulling over long-term solutions such as increased staffing, but that takes years some patients just don't have.
What's happening now are people are going to be waiting. They're going to be suffering for long periods of time instead of being able to enjoy a better quality of life.
Dr. Urbach hopes hospitals will take matters into their own hands, centralizing systems and ensuring surgeries are spread out equally among physicians, maximizing results.
I think we're at a crucial junction right now.
Choosing the wrong path or ignoring the problem could cripple our healthcare system and cost lives. Jamie Mauracher, Global News, Toronto.